Welcome back, friends. So today we are going to discuss about a nuclei of dorsal tire. In our previous classes, we have discussed about the ventral nuclei and other nuclei, anterior nuclei we have discussed. And today class we are going to discuss about the nuclei of the dorsal tire. So in the nuclei of the dorsal tire, we can identify lateral dorsal nuclei and the lateral posterior nuclei. Yes, let us see the lateral dorsal nuclei. There are two nuclei are present. One is lateral dorsal and then lateral posterior nuclei. Okay, these two nuclei, they will come under nuclei of the dorsal tire. Let us see the afferents or inputs of this lateral dorsal nucleus. So lateral dorsal nucleus, it is receiving inputs from the mammillary bodies. So the tract is called as mammillothalamic tract. Mammillothalamic tract. And then coming to the efferents or output, so from the thalamus, it is reaching to the cingulate gyrus. Okay, so the output is from lateral dorsal nucleus to the cingulate gyrus, which is present over the corpus callosum. Yes, coming to the lateral posterior nucleus, the inputs of the lateral posterior nucleus. So the main inputs coming from the ventral posterior nucleus, ventral posterior medial and ventral posterior lateral nucleus. So these two nucleus, they are giving inputs to the lateral posterior nucleus. And medial geniculate body and the lateral geniculate body, these are also from these two nuclei, it is getting inputs. So here you can identify one is this is the lateral geniculate body, and here you can identify the medial geniculate body. Then coming to the output of the lateral posterior nucleus. So output, it is reciprocally connected with the association cortex of superior parietal lobule, that is area number 5 and 7. Let us see that. So here you can identify the output which is coming from the lateral posterior reaching to the area number 5 and 7 in the parietal lobule. Strictly speaking, superior parietal lobule. Okay, so from the lateral posterior, the input is reaching to the superior parietal lobule, that is area number 5 and the 7. Yes, coming to the pulvinar part of the thalamus or posterior end of the thalamus. So posterior end of the thalamus, as we all know that it is also called as pulvinar or pulvinar end of the thalamus. So what about the input and output of this pulvinar end of the thalamus? Let us see that. So the pulvinar end of the thalamus, which is getting inputs from ventral posterior nucleus. So ventral posterior lateral and the superior colliculus and the medial geniculate body and the lateral geniculate body. Okay, so simply remember, one is the pulvinar end of the thalamus, it is reaching inputs from one is from ventral posterior nucleus, that is lateral and medial both, ventral posterior nucleus, then superior colliculus, and then from the medial geniculate body and from the lateral geniculate body. That is the input of pulvinar part of the thalamus. Yes, coming to the output of the pulvinar end of the thalamus. So it provides a massive reciprocal connection. Let us see this. This is the posterior end or pulvinar end of the thalamus. It is connected to the parietal lobe reciprocal connections with the association cortex. So we are seeing here is the right-sided thalamus. So the right-sided thalamus, it is connected with the right-sided parietal lobe, and then posterior temporal and non-striate area of occipital lobe. Let us see that. Okay, so the posterior part of the temporal lobe and the non-striate area to the occipital lobe. Okay, so of both surfaces of the cerebral hemisphere, on both surfaces means medial and the lateral surfaces of same side. So here we are seeing the right-sided cerebral hemisphere, right-sided thalamus. So the right-sided thalamus, which is connected with the right-sided posterior part of the temporal lobe, right-sided posterior part of the occipital lobe. Okay, so that is association fibers. So nuclei of the dorsal tire possess distinguishing peculiarity in that they establish two-way connections with the sensory association cortex without any connection with the primary sensory areas. Then coming to the intralaminar nucleus. So the intralaminar nucleus, which is present in the intramedullary laminae, that is the most prominent intralaminar nuclei are centromedian and the parafascicular nucleus. So let us see the centromedian first. So the centromedian nucleus, the inputs or afferents coming, they receive input from, one is receiving from the reticular formation from the brainstem, okay, reticular formation, and also from the other thalamic nucleus, you can see that. So here we can see from the anterior and from the dorsal tire, and here you can see the medial part and from the posterior part as well. Okay, so from all the nuclei of the thalamus, it is receiving the inputs. Yeah. Then coming to the output of it, another input is from area number 4 and the area number 6. Okay, so all these two areas we have discussed in the functional areas of the cerebrum. So from this precentral gyrus, and then the primary motor area, from these two different areas, the inputs are coming and reaching to the intralaminar nucleus, and the centromedian nucleus receiving afferents from the globus pallidus. You can identify the globus pallidus over here. So the globus pallidus is outside part, and the inside part. From the globus pallidus, it is receiving another input. Then other input is the parafascicular and other intralaminar nuclei receives fibers from the spinothalamic tract and from the spinoreticulothalamic tract. That diagram I am not able to show you over here. But these diagrams, you remember, one from the globus pallidus, another one from the area number 4 and 6, another connection is from the brainstem, of reticular formation. Then coming to the outputs. Outputs are most of the fibers from the centromedian nucleus, and the parafascicular nuclei are projected to the caudate nucleus. You can identify the caudate nucleus over here. Okay, caudate nucleus, it is receiving one output from the centromedian nucleus, and another output is reaching to the putamen. So the outside part of the lentiform nucleus, that part is called as the putamen. It is receiving another input from the centromedian nucleus of the thalamus. The collaterals of the thalamostriate fibers establish diffuse connections with the entire neocortex. Entire neocortex means outside entire the superolateral surface, all the neocortex, 90% of the cortex, it is receiving inputs from the centromedian nucleus. Then coming to the midline nucleus. Midline nucleus is a scattered groups of the nucleus in the periventricular region in the interthalamic adhesions are involved in the regulation of visceral activities. So I am showing you the midline nucleus location over here. So the midline nuclei are connected with the hypothalamus and with the dorsomedial and intralaminar nucleus of the thalamus. Okay, so just remember about it is connected to the intralaminar nucleus. Then moving to the next one is, here you can identify the midline nucleus is connected to the frontal lobe over here, and from the precentral gyrus, area number 4 and 6. So from all the cerebral cortex, medial surface. Then coming to the connections between the cerebral cortex and the thalamus. So the reciprocal connections between cerebral cortex and the thalamus form a fan-shaped thalamic radiation. Let me show you. Yeah, here you can identify. So from the thalamus, all the fibers which are extending upwards, they appears like a fan-shaped radiation. So this radiation is called as thalamic radiation. The fibers of which pass through the different parts of internal capsule. The thalamic radiation is divided into 4 peduncles. So here you can identify how the fibers are passing through the different areas of the internal capsule. This V-shaped part is nothing but the internal capsule. So this part is called as thalamic radiation. So from the thalamus, the connections which are passing through the internal capsule and reaching to the different areas of the cerebral cortex. So the fibers, they are called as thalamic radiation. The first one is the anterior peduncle. So the anterior peduncle connects the frontal lobe. It is the fibers that are passing through the internal capsule, anterior limb of internal capsule. These fibers, they are coming from the anterior group and the dorsomedial group. So the anterior group, yellow one, the blue color one I'm showing you, the dorsomedial group. So these two different groups, the fibers, they are passing through the anterior limb of internal capsule and reaching to the frontal lobe of the cerebrum. Okay, so frontal lobe of the cerebrum, that is about the anterior peduncle fibers. Then coming to the superior peduncle fibers, they are passing through the posterior limb of internal capsule and they are reaching to the precentral gyrus and the postcentral gyrus. Precentral gyrus in front of the central sulcus of Rolando, that is precentral gyrus, and behind the central sulcus you can identify the postcentral gyrus. So the precentral gyrus, that is area number 4, postcentral gyrus, that is area number 3, 1 and 2, they are receiving connections from the lateral group. So that is superior peduncle. So they are receiving connections from the ventral nucleus of the thalamus, ventral anterior, ventral posterior. So from these 3 different groups of the ventral nuclei of the thalamus, the connections are passing through the posterior limb of internal capsule and reaching to the precentral gyrus and the postcentral gyrus. And the posterior peduncle, it connects the lateral geniculate body, and they are moving the sublentiform nucleus. Okay, so sublentiform nucleus, retrolentiform part of the internal capsule and reaching to the area number 17. And last one is the inferior peduncle. Inferior peduncle is a narrow band which is coming from the medial geniculate body, and they are passing through the sublentiform part of the internal capsule and reaching to the area number 41 and area number 42. That is about the connections between cerebral cortex and the thalamus. Thank you, dear students. In the next class, again we'll come with a new topic. Till then, see you. Yes, coming to the clinical aspects of this nucleus, thalamus nucleus and their connections. First, let us move to the anterior group. So the anterior nuclear or anterior nuclear group, and its clinical aspects of it is, so the anterior thalamic group is incorporated in the Papez circuit of limbic system, and a lesion affecting the anterior group may produce Korsakoff syndrome with loss of recent memory. Okay, that is about the anterior nuclear group. Then moving to the next one is dorsal medial group. Dorsal medial group or dorsal medial nucleus. It acts as, let us see that where is dorsal medial nucleus. So the dorsal medial nucleus, which is present over here, just lateral to this midline nucleus. So the dorsal medial group, clinical aspects or functional aspect is the dorsal medial nucleus. It acts as integrating center for somatic and visceral impulses. So through its connections with the prefrontal cortex, it provides mood or feeling tone to the emotional aspect of behavior. That is about the dorsal medial group and its importance and the functional aspect of it. Then moving to the next one is the ventral anterior nucleus. Here you can identify the ventral anterior nucleus. So the ventral anterior nucleus along with the ventral lateral nucleus of the thalamus convey information to the motor areas of the frontal lobe from the corpus striatum. What is corpus striatum? Already have discussed in the basal ganglia. where the caudate nucleus, head of the caudate nucleus, and the putamen, they are joining with each other. That part is called as corpus striatum. So they are passing. So the ventral anterior, along with the ventral lateral nucleus of thalamus, convey information to the motor areas of the frontal lobe from the corpus striatum and from the substantia nigra. So in degenerative lesions of the basal ganglia, the thalamic nuclei discharge abnormally and give rise to dyskinesia. Okay, that is about the ventral anterior nucleus. Okay, this is about the ventral anterior nucleus. Then moving to the ventral lateral nucleus. So the ventral lateral nucleus convey impulses from the cerebellum and from the basal ganglia to the motor cortex and exerts its role as a prime mover of the motor pathway. The surgical ablation of ventral lateral nucleus may abolish the tremor and rigidity of Parkinson's disease. Okay, that is about the ventral lateral nucleus. And coming to the ventral posterior nucleus. So from a clinical point of view, the connections of ventral posterior nucleus are most important. Okay, they are very most important because it's a small medial portion, and the ventral posterior medial nucleus, it is receiving the general sensory modalities from the head and face through trigeminal lemniscus, and taste sensations from the taste buds through solitary-thalamic tract. Okay, from the solitary lemniscus to the thalamus to the ventral posterior medial nucleus, and the tract is called as solitary-thalamic tract, and it's a larger lateral portion. So the ventral posterior nucleus, it is having small medial and larger lateral portion. So the medial portion, it is receiving connections, general sensory modalities from the head, face through the trigeminal lemniscus, taste through the solitary-thalamic tract. And ventral posterolateral nucleus, it is receiving exteroceptive sensations, that is pain, touch, temperature through spinal lemniscus, and then proprioceptive sensations, that is muscle and joint sense vibration, 2-point discrimination through medial lemniscus, and from the rest of the body except the face and head. So the face and head, they are reaching to the medial, whereas the touch, temperature and the pain, it is reaching to the lateral nucleus, ventral posterolateral nucleus. Okay, all the sensations reaching the ventral posterior nucleus are carried to the primary sensory area of the cerebral cortex by fibers passing through the posterior limb of internal capsule, that is superior thalamic radiation. Okay, so already I have shown you the superior thalamic radiation, posterior and the inferior, and also the anterior thalamic radiation. Okay, once again, you just see through it, go through it, and you will understand clearly, right? So that is about the ventral posteromedial and ventral posterolateral nucleus. So the vascular regions involving the posterior limb of the internal capsule, which are not uncommon cause impairment of all forms of sensibility on the opposite side of the body. That is about the ventral posterolateral nucleus. Then the integrity of anterior nucleus and its connections is necessary for attention and the recent memory. That already have discussed about it. There is anterior nucleus and the ventral anterior, ventral lateral, and the ventral posterior nucleus, and dorsal medial group nucleus. Then moving to the next one is the thalamic syndrome. Thalamic syndrome, it is a disturbance of the thalamic function due to lesion of the thalamus, usually after vascular impairment. The symptoms vary according to the site and extent of the lesion. All modalities of the somatic sensation may be diminished on the contralateral side of the body. The threshold for touch, pain, temperature is usually raised on the opposite side. When the threshold is reached, the sensations are expressed in the perverted, exaggerated, and disagreeable forms. So a small pinprick, if you just prick a small pinprick, it may be felt as intolerable burning pain. They feel intolerable burning pain. Even the pleasant music also, they feel it is very disturbing. And sometimes the patient with eyes closed, is unable to locate the position of the limb. So if you ask the patient to close his eyes and find out where his limb is, he could not identify the limb. So that condition is called as thalamic phantom limb.